After a traumatic injury, regaining independence is a long and emotional process. We're going to get an insight into an aquatic program for spinal cord injury. We'll find out about the benefits of this program and meet two special people when we get back. Please stay tuned.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program was inspired by a quotation from Robert Browning. Grow old along with me, the best is yet to be, the last of life for which the first was made. Now, sit back and enjoy a program made especially to provide seniors with useful information, plus some lighter moments to brighten your day.
Mom, watch me. Okay, do it now. Do it now. No. Okay. Very nicely done.
Welcome to another edition of The Better Part. I'm Val Jeffrey, your host. Rehabilitation after a spinal cord injury is often a very long and arduous process. Patients and their families work with a dedicated, caring team to maximize strength and independence. Today, we're talking with one of those caring people, and we'll learn about pool therapy, often a significant step in the rehabilitation process. Later, we'll be joined by Molly Hale and hear how she has benefited from pool therapy. But first, I'd like you to meet Heather Weissel. Heather is a recreation therapist at the Santa Clara Valley Medical Center. Welcome, Heather.
Thank you.
What department do you report to within the Santa Clara Valley Medical Center?
Well, at Valley Medical Center, there are 2 rehab units, and each rehab unit has a wide range of therapists, all of whom, occupational therapists, physical therapists, recreation therapists, and speech therapists, are in one department called Therapy Services, and that's where how we're grouped.
Well, tell me about your job.
Well, actually, as a recreation therapist, we get to work closely with all of those therapists and work together with the patient, but each of us has our own focus. And in recreation therapy, our focus is really on helping the patients reacclimate to life, really outside the hospital, and to get reintegrated into the things that they enjoy doing, their leisure interests, and get their lifestyle back on track.
At what point is pool therapy introduced into this process?
Well, when we first meet with a patient, we let them know that that's available to them, and we gauge whether they're interested and also if it's something they were doing before they were injured. And it's not a criteria. If they like the idea of just trying it, then so be it. And usually a week or so into their rehab experience, once they're up and moving and doing physical therapy and occupational therapy on a daily basis, we'll start to get them into the pool. Again, if it's something they're interested in doing, and once they've gotten a clearance from their doctor that they can do that.
So where's the pool located?
It's actually in the hospital. It's in the basement, so it's 1 floor below where they are normally, where they sleep and where they do the rest of their therapy. So it's very convenient.
Okay. Well, we have some footage of you in the therapy pool, so let's run that and you can explain what's happening.
Okay. What you see here is this is just before we're getting ready to go swimming. I usually spend a minute or 2 with the patients at poolside just to give them an orientation so that they're clear of what's going to happen. And then to get in the pool, we transfer onto this lift, which you can see Barbara is using a sliding board to get herself from her wheelchair onto the pool lift.
Tell me a little bit about Barbara.
Barbara has what's called an incomplete spinal cord injury, which means that she actually has the ability to move her legs, although she's not able on land to bear her full body weight or to do any walking on land. So she could move them, and you might see her moving them in the water a little bit, but she's really using exclusively her wheelchair on land for all her mobility. And then here we are, we rotate the lift over the water. As you can see, the therapist is already in the water, so the patient is comfortable knowing that there's somebody waiting for them. The lift is lowered down, and when she reaches the water, we'll put a flotation device a belt, usually just one, sometimes two, around their waist. And then once we've got the belt secured, we'll move right into, we'll glide off the lift and begin with floating. And when we're in the pool, we usually teach 5 basic swimming skills, and we progress the patients through the 5 skills depending on their comfort level, and always asking them as we move from one to the next, are they ready to move to the next skill? So we've glided off the lift and we focus right away on floating. We've got her arms out and her palms up, and I'm talking her through it, making sure she's comfortable, giving her some verbal cueing, letting her know her head should be way up, her chin up so that her head is back, and keeping her face nice and dry. And then once she's comfortable with the floating and she's really gotten basically acclimated to being in the water, I'll start explaining to her the next steps we're going to do is go into a basic swimming stroke, an elementary backstroke. And I'll actually instruct that by putting my hands on the patient and manipulating their arms in the manner that they're going to be doing the stroke. So you'll see here in a minute that I'll actually hold on to the patient to her arms and guide her through the stroke, talk her through it. And then once we've been through that process and they're comfortable, we'll actually go ahead and start doing some basic lap swimming. So here we are. I'm demonstrating the regular backstroke, which I'm differentiating for her that that's actually not what we're going to do, although it might be what she's familiar with, in order to distinguish the difference between what she might have been familiar with before and what we're going to focus on in the adapted form, giving her an idea of how she might expect to feel when she's moving through the water. Giving her some guidelines as to how to form her hands, keep her fingers together, create a cup. And then really demonstrating the stroke. Also pointing out the features of our particular pool and our setup so that she's aware of when she's reaching the end of the pool, when to begin making a turn, so that she can really be as independent as possible. And then here she goes.
Do the patients actually have to have been able to swim before their injury?
No, that's actually, in some cases it's a positive, and in some cases if they're real strong swimmers from before their injury, that can be a negative, because it's hard to reteach someone to do things in a foreign way. And people, so being able to swim before is, like I said, can be a plus. But absolutely not a requirement. So it's real exciting when you get somebody in for the first time who's really not been a strong swimmer beforehand, and realizing that this is a great option for them and something they can do for leisure, for a real great workout, and just for fun. So once we've done floating and the backstroke, I teach the patient how to sit themselves up. We haven't actually seen that here, but you can see she's sitting up, and I'm now demonstrating what's called a log roll, which is a technique to get from your back all the way around onto your face and back again onto your back. And again, just as I did with the backstroke, I'm physically demonstrating for the patient using her own body, so she gets a sense of the feeling of the motions that she's going to do, the strategies for facilitating the technique, the movement. And once she's comfortable and that she understands what she's going to do, we'll talk, make sure she's had an opportunity to ask and have answered any questions, and then she'll go ahead and actually try it. And again, this is a log roll, which not everybody does the first time they're in the pool. It's a question of their comfort level, getting their face wet. But as we complete each skill, we'll ask the patient, and in this case, she was comfortable moving on to the next skill. So the expectation is that once we've finished talking about it, which we take about 2 or 3 minutes to talk about it, then she'll actually attempt it. And if she does it well, it should only take about 5 seconds. So a lot of time talking about it and not much time doing it. But always want to make sure before they're rotating over and going to put their face in the water for the first time that they really are clear and they understand And so here we are, she's getting ready to try it. My hands are completely off her. And then she's struggling a little, so we're making modifications to accommodate for her body type. She's actually a particularly tall woman, over 6 feet, with real long arms. So we're just making some modifications to the strategy so that it works optimally for her. And there she goes, rolling over and continuing the rotation, and then she's able to sit herself up, and my hands are not moving at all.
See, we spend a lot of time talking about it and not much time doing it. Would you like to do that again? Now, women, we are better floaters.
Again, there are 5 basic skills: the floating, the elementary backstroke, sitting themselves up, the log roll, and then if they're interested, face down swimming, prone swimming is what we call it, which is a modified breaststroke, which you can see Barbara is attempting here and doing well. She needs a little verbal cueing here to put her head in the water in order to get a better position, which you can see she moves a lot more easily when she does that.
You're almost there. Part of it is that because you're moving up.
And as I mentioned, Barbara does have some use of her legs, although not functionally on land at this point in her rehab. But it's not uncommon when a person does have that capability when they're in the water, because of the ease of movement, that they might like to experiment a little bit with standing up. And here she's using 2 flotation devices and my assistance at her waist. And then here she goes, just doing some recreational swimming.
Oh, there you go. This is so exciting. I crawled so far yesterday and I'm swimming.
We don't want any water aerobics yet, though.
And when we're done, we just go back. We just do the whole process in reverse. So the lift comes back in. The patient is assisted to float back on. The belt would normally be removed at this point, although Barbara was comfortable taking it off earlier. So she's all ready to exit the pool and return to the unit.
Alrighty. This is so cool. Thank you so much. You're welcome. Yeah. Great. I'm glad Mom got to see him. Yeah. He's crawling.
That's good. We're going to take him over to Tiffany Center.
Well, your patient certainly looked like she was enjoying herself. Is this a normal reaction?
Actually, yes. The majority of people who get in the pool really have a great time. They're really generally quite pleased with their competency because it happens very quickly. And so in contrast to the things that they're working on with their other therapists, where they really have to work hard to make significant progress and really see their competence in action, it's very typical for a person to get in the pool and really master the basic skills very quickly. So not only is it freedom from the wheelchair, which is a very commonly heard remark from patients, but it's an ease of movement and, again, a competency that happens very quickly. And it's warm. It feels really great. It's usually between 94 and 98 degrees, so it's a very comfortable place to be. And so, yes, all in all, it's generally a really positive experience for people who do it.
And can patients of all levels of disability do pool therapy?
Actually, with very few exceptions, you can't be on a ventilator. But even a person who really doesn't have any movement with their arms or legs can gain some benefit from being in the pool, just if nothing else for meditation and relaxation. As I mentioned, because of the warmth of the water, it tends to be a great strategy for pain management and just for comfort. But really, regardless of who you are and what your circumstances are, there's something to be enjoyed in the water, I feel.
Well, it's a very special job you do. Tell me something about you.
Oh, well, I studied to be a recreation therapist at San Jose State, and I've been working at Valley Medical Center for about 11 years. And it's something I really enjoy. The contact with the patients was really the great joy of the job.
What made you get interested in this line of work?
Well, you know, I actually was very involved in a youth group when I was in high school, and there was a big community service component to the youth group, and it got me very involved in participating in sort of the greater community, and one thing led to another, and just through some guidance with some college counseling, I learned of the field and thought, well, if I can get paid to play and teach others the great joy of leisure, then that seemed like a great path to take, and I haven't regretted it.
So how many patients do you see during the course of the year, would you say, estimate?
It's an estimate, but I would say we probably, in the spinal cord unit, we probably see about 100 people a year, give or take.
And how long do you stay involved with the patient?
Mm-hmm. Well, patients' rehab stays generally range from anywhere from as short as 3 and 4 weeks to as much as 6 to 8 weeks, sometimes a little bit longer, but usually in that 4 to 6 week range. And we're involved really from the very beginning and right through the end. So, you know, a good month or so. And then we like to try to maintain contact after they've been discharged. So we like to stay in touch, but our real therapeutic relationship is about 4 to 6 weeks.
Let's talk about the value of pool therapy in rehabilitation.
We allow them, once we've taught them the basic skills, to kind of direct the time that they're going to spend in the pool according to what their interests and needs are. So if a person, for example, before they were injured, really liked to work out, they went jogging or they ride their bike or they went to the gym a lot, getting in the pool is a real nice way to get right back into that routine of getting in and doing lap swimming, and they might really just get a workout, spend 30 minutes lap swimming. And there are others who, as I mentioned with Barbara, having some use of her legs, it's not uncommon for people who have some mobility in their legs, who aren't really able to focus on that on land because it's not significant enough, to then use the pool as a tool for beginning with their gait training or their walking, which as you can imagine, for a person who's suddenly lost that, that's a wonderful and exciting opportunity to be up on their feet, to be weight bearing, to be mobile in that way, and to feel successful again very quickly. Because if when patients are first trying to do some walking on land and they lose their footing, it's very scary. And if you're in the pool and you lose your footing a little bit, it's not so scary because you might wobble a little but you don't go down, as opposed to, again, if you're on land. So it's it offers everybody something, and it's a rare occasion when you hear somebody say they didn't enjoy it and they don't want to get back in. I would say 95% of the people who get in have a positive experience and want to do it as often as possible.
If they don't have any use of their legs at all, does that change your approach to how you're going to teach the strokes?
No, the strokes themselves, really, like I mentioned in the film, there are 5 basic skills, and we teach everybody who has the functional ability to do those skills, those same skills. We might modify, as I showed with Barbara, that she needed, because she has real long arms, to do things a little bit differently, but the general battery of skills that we teach are the same. And really, unless the person has a severe impairment and they can't use their arms at all, we will introduce all the skills to each patient and let them try to work it out within their own capabilities so that they can be as independent as possible in the pool.
Yeah. Well, next we're going to get a patient's input into the benefits of pool therapy. We've been joined by an inspirational lady who, through sheer determination and hard work, has accomplished a great deal. She's here to tell us what part pool therapy played in her rehabilitation. I'm very pleased to introduce Molly Hale. Welcome, Molly.
Hi, thank you very much. It's nice to be here.
7 years ago, Molly Hale fell asleep at the wheel of her car. The car crashed into the center divider and rolled over. Molly was trapped inside for 2 hours before the rescue team freed her. The impact caused a severe spinal cord injury. The 5th cervical vertebra was fractured, with a dislocation between 6 and 7.
What was the prognosis?
Prognosis for me was no movement past my shoulders for the duration of my life.
Did you set yourself goals along the way?
Goals, yes, at some points in time, but mostly I've held a vision of what was possible for me. So when I speak of vision, I think of seeing myself dancing, seeing myself running, those kinds of visionary things, and then doing whatever I needed to do to address those possibilities.
At what point was the pool therapy introduced to you along the road?
In the hospital, in the rehab, my recreation therapist had mentioned the possibility of using the water for recreation.
If I am this immature, neurological little baby and I'm trying to reconnect my brain to my body and body to my brain, what a wonderful medium to be in.
I considered perhaps that water needed to actually be my front line of therapy, that was the place that I really needed to be, was in the water. It took me about 5 months after injury to get in a large basin of water where I could actually be suspended with my feet down. So I was in a perpendicular to the earth position. And I, at that point, had movement in my arms, and I could actually bring my thumb and my forefinger together on one hand.
What were the benefits of the pool therapy, would you say, if you had to list them?
Where to begin? Water just innately. There's hydrostatic pressure, so the water pushes on the body. And one of the things that happens for spinal cord people is that we're in a sitting position a lot of the time, and the fluids tend to puddle in our feet and in our legs. So being able to be in this upright position with the hydrostatic pressure, with the water actually pushes the blood and the fluids back up towards the heart. Just even if I didn't move, that alone would be a marvelous aspect. Then there's the freedom. Just to be floating around is a tremendous, both the emotional body as well as the physical body. And anything that moves on land, when you're in water, that movement is magnified.
Sometimes it seems like it's not me. It's almost as though I am outside of myself, observing the walking. And part of my process is connecting with the fact that, no, wait, this is me. These are my feet on the bottom of the pool. This is my body responding to the idea of lifting the knee.
And what I'm doing now is retraining my balance.
Right.
The legs are doing, what legs do, and I have the natural movement in the water. But the balance, retraining that is really challenging.
Did you have any use of your legs at all before you started the pool therapy or not? Because we're saying in the video, Barbara had a little bit of use in her legs.
I could move my big toe on my left foot, but I didn't really have voluntary control. I had a lot of spasticity. Anything that I moved, if I could move my knee a little bit on land in the water, that knee then could really bend. And I just kept doing things. I had to completely reorient myself to breathing because I had these really childlike responses to having water in my face. I would, suck in, and I had to counteract that, just patiently retraining my body to respond appropriately. But I'm now at the place where I can bear about 85% of my body weight in water, which means I'm working in shallower water, and I can stand up on my feet and I can walk around. So initially, when I started in the water, I could manage 2 days a week, and I had to have someone with me to dress me, to get me in the water, to get me out of the water, to be in the water with me. And gradually, through time, I'm in the water now 15, 18 hours a week. So I spend, I love 3 hours, 3.5 hours in the water, which is just, wonderful, and I do a variety of things in that time.
There must be a spot in the Olympics for you, I think.
Perhaps. You know, I did, one time I did a triathlon where I did the swimming part and other people did the bicycling and the wheelchair part. You know, so water is just natural for me.
How important were the therapists like Heather to you when you were in the pool?
Oh, the encouragement that I received from my therapist, especially the recreation therapist, was life-giving. You know, it really, I don't know how I can express you know, my love and just the love for the people that were in my life.
So Heather, what qualifications does someone need in order to become a recreation therapist?
We actually have to have a degree in recreation, and then you have a long process of an internship and lots of time as a volunteer before you're even eligible to sit for an exam, and then you have to become certified. So it's a 4-year college degree plus an internship, and then, as I said, you have to pass the exam. There's a state exam and a national exam. So it's not just fun and games. It's definitely a lot of academia behind it, but and a lot of hands-on. The internship is a real great hands-on experience.
Well, I think we saw from the video what a great job you do. If someone was thinking about doing it, what would you say to them?
I would say if it's something you're interested in doing, then to talk with people who are doing it, and to visit centers and community-based programs and decide if it's something you want to do in a clinical setting, or if you like to be in the community, at community pools or in parks and recreation centers, because there's really a lot of variation where a person in recreation with a degree in recreation therapy can work. So if a hospital setting doesn't seem like it's a fit for you, to do this kind of work and to do wheelchair sports or other kinds of you know, recreational activities out in the community, there are just tons of opportunities, but you just have to set your mind to it and then really explore.
Yeah. Well, on behalf of the Better Part, I want to thank you both for coming. It's obviously a team effort, but we get results in the end, right?
Definitely.
So there's hope out there, and I thank you very much for coming.
Thank you.
Yeah, thank you. Thank you. Yeah, it's a pleasure.
I think so.
Yeah, it's good to be here with you.
You too.
Yeah.
We would like to thank the Santa Clara Valley Medical Center for permitting us access to the therapy pool, and many thanks to therapists Heather Weissel and Jill Parsons, and pool patients Barbara Ward-Selby and Brian Demps. That's all for now. You can reach us through the Cupertino Senior Center, 408-777-3150, or visit our website, www.thebetterpart.com. Join us again, and thanks for watching.